the general cranial treatment, starting off with an OA. The OA positioning, if you want to see right here, basically the pinky finger and ring finger are just in the soft spot above the spinous process of C2. They basically curl. It's a curling movement and a lateral separation as the tissues soften. Hold that until you feel it release. From there, you basically create a basket that your thumbs will end up supporting the greater occipital protuberance. Essentially what I'm doing is I'm lifting the head, I'm folding the hands over in this way so that the greater occipital protuberance, or inion, is just between the thumbs. I hold that and let the head do the work, and I'm waiting for the area underneath my fingers to soften. I then move it up, let the head do the work of the weight of the head of the gravity to do it, and I keep moving it around. I'm doing it a little faster than I normally would do it just because you're videotaping it. And then I come to up to here along the sagittal suture. Here I'm crossing my thumbs and I'm leaning my body to create the force. And I just kind of work it through. Again, I'm going faster than I normally would go, but the idea is to soften it. Once I get up to where the frontal bone is, the coronal suture, because this becomes uncomfortable for me to do it that way, what I'll do is I just flip it around and I then come down the frontal bone, separating where each finger is placed. I walk it all the way down until I get to the nasal frontal intersection. At that point, I then lift and separate. The hand on the frontal is lifting and separating. Hand on the nasal is grasping the tissue, the nasal region, and lifting it. So the goal is to try to lift this up to decompress this area. After that, go to a frontal lift. So I'm right over the frontal bone, waiting for flexion. Once I wait for flexion, have the person breathe in. I try to gently lift. It's a lifting type of movement following the line of the orientation of the head. Nice and easy, just lifting it up. Okay? After the frontal lift, we go to the parietal lift. Make sure you're posterior to the coronal suture and superior to the temporal bone. One of the tricks you can do is have the person clench their teeth. They clench their teeth, you feel for the temporalis muscle, make sure you're superior to it. Thumbs are off the head, making a bit of a ice hook, ice tongue kind of situation. Again, gently you can compress medially and wait for it to respond into flexion. Flexion typically is this type of a movement. So once you feel it kind of open up into your hands, you just gently lift towards yourself until you feel it kind of decompress. Then we go on to temporal. Now temporal, we can do one of three things. We can go into the ear canal, just inferior to the zygomatic arch with the pointer finger, just superior with the thumb, ring finger on the mastoid process, pinky finger along for the ride, and basically just wait to feel for flexion extension. Flexion is external rotation, extension is internal rotation. So you're feeling for this movement, and all you want to do is enhance it or augment it. That's one of the things you can do. Another thing you can do is hold the occiput with the thumbs on the mastoid process. Okay? So it's this kind of thing on the mastoid process. Basically during craniosacral flexion, the general census in what you feel in the thumbs is that they move medially, like this. Okay? This kind of a thing for flexion, this for extension, this for flexion, this for extension. So what you want to do with this is follow it into flexion, hold one side, let the other side come out, and then basically let it wobble, and it'll rectify itself, and it'll normalize, and it'll come back stronger than before. And you do that from this handhold. After that, or in addition to that, or by itself, you can just do a simple ear pull technique where you're underneath the ear with one finger, over top of the ear with the other, with the thumb, and you pull straight down laterally. It's a straight down lateral kind of pressure. And this is good to help to encourage temporal movement. You also, with the jaw, you can have the person open and close their jaw. Open and close your jaw, or they can deviate the jaw to the left or the right to further stretch this line of tension through here. After that, temporal work, whether you're doing this one, whether you're doing this one, or whether you're doing the ear pull, or any combination of them, then you finish up with a CV4. A CV4 hand position is like you're bumping a volleyball. Bumping a volleyball, you want the external occipital protuberance to be right in the fleshy part of the hand. Generally the way it works is that craniosacral extension feels like it's emptying out of your hand and moving towards you. Craniosacral flexion feels like it's filling in your hand and moving away from you. So what you want to do is resist the filling phase, resist the flexion phase, follow the extension phase. Head up, nice and easy. So the hands underneath like that, you're resting and relaxing. You follow that until you basically experience a stopping of the flexion phase coming. It goes into what's called a still point. You wait a little while until the flexion phase starts to come back. When it starts to come back, you just follow it and let it go, and that basically is the general cranial treatment. Okay? Very good.
Thank you very much.